Today we are starting the pharmacology of nervous system, and in nervous system we will discuss autonomic nervous system. You all know about the nervous system classification. Can you classify nervous system? Nervous system is divided into two parts. Central nervous system. Nervous system is divided into two parts: the central nervous system and peripheral nervous system. The central nervous system is composed of brain and spinal cord, and peripheral nervous system is further divided into sensory and motor. Sensory peripheral nervous system and motor peripheral nervous system. The sensory is further divided into two parts: general senses and spatial senses. And this motor peripheral nervous system is further divided into somatic nervous system and autonomic nervous system, right? We will focus on autonomic nervous system. By sensory nervous system, the body takes impulses from outer side environment, and by motor system, it gives back the signals to the effectors and gives some responses like contractions of muscles, bradycardia, pupil contraction, pupil dilation, tachycardia, lungs, breathing rate, etc. Right? So this autonomic nervous system is further divided into two, because our body has two systems, two control systems. One is in normal and rest position, and one is fight and flight conditions, emergency condition. So this autonomic nervous system is divided into sympathetic and parasympathetic nervous system. The sympathetic nervous system is responsible for emergency conditions, fight and flight, and this parasympathetic is working in rest condition, right? So first of all, we are starting the pharmacology of autonomic nervous system. We will discuss in detail the drugs which enhance the activity of autonomic nervous system, and also after the enhancement we will discuss the drugs which inhibit the activity of autonomic nervous system. But before we really go into the drugs of autonomic nervous system, let's know about the sympathetic and parasympathetic divisions of nervous system. Which nerve is parasympathetic? Cranial nerves. Do you know about cranial nerves? How many cranial nerves are there? Cranial nerves. Cranial nerve number 1 is olfactory. Cranial nerve number 2, optic. Cranial nerve number 3, oculomotor. Cranial nerve number 4, trochlear. Cranial nerve number 5, trigeminal. And trigeminal is further divided into three divisions. One is optic, second is submaxillary or maxillary division, and mandibular division, right? And cranial nerve number 6, abduction. Cranial nerve number 7, facial nerve. Cranial nerve number 8, vestibulocochlear nerve. Cranial nerve number 9 is Pharyngeal nerve. Glossopharyngeal nerve. Cranial nerve number 10 is vagus nerve. Cranial nerve number 11 is accessory nerve, and cranial nerve number 12 is hypoglossal nerve. Right? We have two systems in an autonomic nervous system, the sympathetic and parasympathetic. The cranial nerve number 3, cranial nerve number 3 is parasympathetic, having parasympathetic activity. Right? Cranial nerve number 7, the facial nerve, also parasympathetic nerve. Right? Cranial nerve number 9, parasympathetic nerve. Right? And cranial nerve number 10 is also parasympathetic nerve. Right? So first of all, we will discuss the parasympathetic nerves in cranium or in cranial parts and brain stem. Right? And after, we will discuss the sympathetic nerves which are arising from the spinal cord. Right? First, we will discuss the nuclei, the divisions and the activities of all these four nerves, the third, seventh, ninth and 10th. Remember these nerves with yourself, that they have parasympathetic activities in brain. All the other have, some of them having both activities and some of them having only sympathetic activity. Right? So let's start in nerves. Because we are discussing the cholinergic drugs. Cholinergic drugs. For cholinergic drugs, first of all, it is necessary to know about the cholinergic system of brain, the cholinergic nervous system. So we are discussing the cholinergic nervous system. This is generally the division of nervous system. Now, cholinergic system. For your easiness, I have divided this your cholinergic drugs chapter into 3 or 4 parts. In first lecture, we will discuss some physiology and anatomy of this cholinergic system, also the nuclei and the supplies or the synthesis of acetylcholine. Acetylcholine, what is acetylcholine? What is the function of acetylcholine? Right? What are the receptors? And second part, we will discuss the classification of cholinergic agonist drugs. And third parts, we will discuss some of the drugs from cholinergic agonist, the mechanism of action, the side effects, the interactions, the indications, the contraindications, pharmacokinetics. Right? And after that, we will go for cholinergic antagonist, the drugs which inhibits the cholinergic system. We will classify the drugs. We will study the indications, contraindication, mechanism of action, side effects and toxicologies of these cholinergic antagonists and last part of this system. Right? So this is the first part. First, it is necessary to know about the physiological functions of the cholinergic system. So we have cholinergic system. What is cholinergic system? The system which is working on acetylcholine. The stimulatory neurotransmitter for cholinergic system is acetylcholine. So all the neurons including in cholinergic system will be working on acetylcholine. Either they connect with the muscles in neuromuscular junctions, or they connect with the neurons, or postganglionic or preganglionic, but they are working on acetylcholine, so they are called cholinergic neurons. And the system which is made by this cholinergic neurons is called cholinergic system. This cholinergic system having cholinergic neurons. What are the types of neurons and nervous system? We have 3 types of neurons. One is afferent neuron, second is efferent neurons, and one is intermediate neuron. Afferent neurons always coming towards central nervous system. Efferent neurons always leaving central nervous system, and the intermediate neurons making communication between the afferent and efferent neuron. For example, this is the nervous system. And for example, from here, this is the nuclei, for example, and from here the neuron is going towards body. This neuron is called efferent neuron, right? And for example, this is the neuron coming toward central nervous system. This is called efferent neuron, right? So, and here is the neuron which communicates between the efferent and efferent neuron are called intermediate neuron. So all the intermediate neurons basically they are cholinergic, right? We will classify these neurons on the basis of cholinergic activity, right? Because this cholinergic activity is different in sympathetic and parasympathetic nervous system. So first of all, cholinergic system, sympathetic cholinergic nervous system and parasympathetic cholinergic nervous system. For that we will take the central nervous system, and these nerves are very important for this cholinergic system. First of all, I am taking the parasympathetic, because parasympathetic activities in body are very important. For example, if you are in emergency conditions, which system is working? Sympathetic. And when you are in rest condition, parasympathetic. So rest condition occurs before emergency condition. If you know about the rest nervous system which are working in rest condition, you will easily understand the emergency conditions, right? So first of all, parasympathetic nervous system. In parasympathetic nervous system, cholinergic parasympathetic nervous system is divided into two parts. One is the nerves which are arising from the brainstem, and the nerves which are arising from spinal cord, right? So the cranial cholinergic parasympathetic nervous system and the spinal cholinergic parasympathetic nervous system. First, for example, this is brain and spinal cord. First of all, which nerve is parasympathetic? Third. So third nerve is arising from brain. For example, here it have a very beautiful nucleus. This is the nucleus of third nerve nucleus, right? And neurons are arising from this third nerve nucleus. This neuron is called preganglionic neuron. What is ganglia? What is the difference between nucleus and ganglia? Collection of cell bodies. And peripheral nervous system is ganglia, and collection of cell bodies in white matter of central nervous system is called nuclei. So this is the nucleus, and here it forms the ganglia. Right? This is third nerve. Third nerve is called oculomotor. The next is, for example, here is this is the pons, and here we have the nuclei, and from this nucleus the nerves is arising, which is called facial or seven nerve, and it also making a ganglia here in peripheral nervous system, and these are the postganglionic neurons, right? The next is we have the ninth nerve. For example, this is the nucleus of glossopharyngeal nerve, and this glossopharyngeal nerve is making the preganglionic neuron and postganglionic neurons. Right? The next is we have a very important nerve here which is called vagus, and a very large nuclei, and from this nucleus the vagus nerve is arising, but at not making one ganglia or specific ganglia here. Right? It is very long now, very long. Right? So, for example, what is cholinergic? What are cholinergic neurons? All the neurons which are preganglionic and postganglionic, in cranium stem, are the nerves which are arising from cranium, are cholinergic neurons. Right? Remember this point with yourself. The drugs, for example, the cholinergic agonist, cholinergic antagonist, are working on in cranial nerves on preganglionic neurons as well as on postganglionic neurons, because both the neurons are cholinergic neurons. Right? Mean that from here it will release acetylcholine. Here it will release acetylcholine. Here it will release acetylcholine. Right? Let's know about these nuclei. What is the name of this nuclei? Third nerve nucleus. Third nerve nucleus is called Edinger nuclei. This is Edinger nuclei, the third nerve nucleus. This seventh nerve, this is seventh nerve, this is ninth nerve, and this is 10th cranial nerve. This nucleus is called, this green nucleus is called superior salivatory nuclei. Do you remember these nuclei? I have discussed in detail these nuclei in central nervous system in first semester. Right? What is the name of this nuclei? This black one, the ninth nerve nucleus is called, this nucleus is called inferior salivatory nuclei. Right? And in last, this nuclei, which is the nucleus of 10th or vagus nerve, this is the dorsal nuclei of vagus nerve. The dorsal nuclei is parasympathetic. This nerve is called oculomotor. This nerve is called facial nerve. This nerve is called glossopharyngeal nerve, and this nerve is called vagus. Right? There are specific ganglia for these nerves, and these ganglia are also working on acetylcholine, mean they are cholinergic ganglia. Right? What is the name of this ganglia? Anyone? What is the name of this ganglia which are making by this third nerve, cranial nerve? This is called, remind the eye, the structure of eye. I have discussed this ganglia in your eye lecture. Ciliary ganglia. Ciliary ganglia. Right? What is the name of this ganglia which are making by the seventh nerve? This is called supino-palatine ganglia. It is called supino-palatine ganglia. Right? What is the name of this ganglia which are making by this ninth cranial nerve? It is called otic ganglia. It is called otic ganglia. Right? And what is the name of this ganglia? What is the name of this vagus nerve ganglia? The vagus nerve making the ganglia with the stomach, with the small intestine, with the liver, they are very short and they are different, right? There is no a specific ganglia for vagus nerve. It is very long now. Now, these are the nuclei, these are the ganglia, and now we will discuss the supplies of these nerves. Which organ is supplied by these parasympathetic cranial nerves? First, third cranial nerve, which is oculomotor. This is presynaptic neuron. These neurons are presynaptic or preganglionic neurons. These all are preganglionic neurons, and these are postganglionic neurons. And cranium, the parasympathetic neurons, the preganglionic and postganglionic, both are cholinergic. And both are cholinergic, right? So the first one, this is the first one, and this nerve supplies the parasympathetic activity to eye, your eye. For example, this is the do you remember the structure of eye? This is optic nerve, and these are ciliary bodies are muscles. This nerve supplies ciliary muscles. For which purpose? In parasympathetic activities, mean in rest condition, your pupils are constricted. Your pupils are constricted, mean that when you are in rest condition, your ciliary muscles are constricted. For example, this is the lens. This is your lens, and these are suspensory ligaments, right? In parasympathetic activities of nervous system, these muscles are constricted like this. For example, this is the constricted ciliary muscles, and your pupil is constricted. So pupil constriction is the first function of parasympathetic nervous system, which is the role of third cranial nerve. My name is oculomotor. So this is pupil constriction. And when there is some emergency condition, your eyes are right dilated, and you are looking for the emergency situations, right? So in that condition, this neuron is not working. The sympathetic activities are working, right? So this is the first one. The second, the supinopalatine ganglia. Supinopalatine ganglia. But there is very important another ganglia making by this facial nerve, which is called submandibular ganglia. Submandibular. So for example, from here, this is there are two ganglia made by facial nerve. One is supinopalatine ganglia. Second is submandibular ganglia. Right? This is submandibular ganglia, and both the ganglia are cholinergic, mean they are working on acetylcholine. First, this supinopalatine, it's supplying the mucosal membranes of nose, right? Mucosal membrane of nose, pharynx, etc. All the mucosal membranes which are associated with this area, right, are supplied by this supinopalatine ganglia. And this submandibular is supplying two organs. One is sublingual salivary gland and submandibular salivary gland. These are autonomic nervous system, because for example when you are walking on road or in front of some houses and you detect the smell of a very delicious food, right? Your saliva secretion started because this is autonomic nervous system and this is parasympathetic activity, right? So these glands are also supplied by the 7 cranial nerve, which is called facial nerve, the sublingual and submandibular. How many salivary glands? 3: parotid, sublingual, submandibular. The sublingual and submandibular are only supplied by facial nerve, right? Now the ninth cranial nerve, which having otic ganglia. This otic ganglia, it's supplying another organ which is called parotid salivary gland. These are the parasympathetic innervations, right? And this is the vagus nerve. Vagus nerve is very important and this is very long nerve and it's supplying most of the organs in GIT, gastrointestinal system. So for example, this is the vagus nerve, cranial nerve number 10, and we have digestive system here. For example, this is the esophagus, this is the stomach, and this area is not enough for this system, so we will supply it separately. For example, first it's supplying esophagus, also it's supplying anyone the very special thing in mouth which having the taste buds. The taste buds are present on tongue as well as epiglottis. Epiglottis having also taste buds, and epiglottis it's supplied by vagus nerve, vagus innervation, right? The stomach is also supplied by vagus nerve, right? The liver is also supplied by vagus nerve. The pancreas is also supplied by vagus nerve, and the small intestines are supplied by vagus nerve. In large intestine, the cecum, the ascending colon, and transverse colon, they are supplied by vagus nerve, right? This vagus nerve also supplies the heart muscles, right? But remember that AV and SA nodes are supplied by different branches of vagus nerve. SA node is supplied by the right branch of vagus nerve and AV node is supplied by the left branch of vagus nerve. So heart is also supplied by vagus nerve, but the SA node, for example, this is heart, for example, this is your heart, right? And this is the SA node and this is the AV node, right? This SA node is supplied by the right branch of vagus nerve and this AV node is supplied by left branch of vagus nerve, right? So from here, the epiglottis, what is the role of epiglottis? And rest condition, what is the role of epiglottis? When the food is coming to the food pipe, it blocking the trachea, and when we are inhaling the air, it blocking esophagus, right? The second role of epiglottis is it having a lot of taste buds, epiglottis, and it also detects the bitter taste from mouth, bitter taste, because bitter taste is detected by the posterior side of your oral cavity, and taste buds are present on the epiglottis in rest condition, right? What is esophagus? This is epiglottis. Epiglottis having two functions. For example, this is the esophagus and this is the trachea. This is the trachea, and this epiglottis is present here at blocking the esophagus and trachea during the food and inhalation breathing, and it also having taste buds, and it can detect the taste. The second is esophagus. In rest condition, by parasympathetic activities, the esophagus is working as peristaltic movements. It perform peristalsis. And what is the role of peristalsis? Peristalsis is responsible for taking the food from oral cavity into stomach. So esophagus is also supplied by vagus nerve, and it maintaining the peristaltic movements. And in sympathetic activities, you will get anti-peristalsis, vomiting, right? Next, stomach is also supplied by vagus nerve. Now, what is the role of stomach in rest conditions? Mechanical digestion, mean contraction. These are smooth muscles and they are contracted by this vagus nerve, and vagus nerve is working on acetylcholine, and acetylcholine is responsible for the contraction of smooth muscle. The next is gastric secretions. Right? All the secretions, the secretins, the cholecystic kinases, the trypsin, they are all secreted under cholinergic activities. The next is liver. What is the role of liver in normal conditions? Metabolism, as well as the conversion of extra glucose into glycogen. And when glycogen is enough, and what will happen to the glucose? If liver is responsible for converting the extra glucose into glycogen, and liver fulfilled its capacity for glycogen, there is no more glycogen can make by this liver. What will happen to the glucose? Diabetes? No. There is homeostasis. A lot of homeostasis process in our body. Negative, positive. No, you are wrong. Glucose will convert the extra glucose from glycogen. When glycogen is enough, the glucose will be converted into other substances like lipids, proteins, right? It will form the new substances, the lipids, mainly lipids. It will make lipids. This is the reason why the people get obese when they are taking more glucose. Lipids are responsible for getting wet, but this glucose is indirectly converted into fats, lipids, when they are in excess amount from glycogen, right? The next is pancreas. What is the role of pancreas? It making the pancreatic juice. Also it make insulin. Also it make glucagon, and these are responsible for maintenance of glucose level in plasma and blood plasma. What is the role of small intestine? Absorption. Good. This is the role of small intestine, absorption as well as so the transport of the extra food to large intestine, right? The next is the cecum, ascending colon and transverse colon. They are supplied by vagus nerve. And what is the role of cecum? This is the first part of large intestine supplied by small intestine, the ileocecal junction. And this is the only part which having more diameter as compared to its length. It having, I think, 9 centimeter in diameter and 6 centimeter in length, right? Water reabsorption is the main role of large intestine. but firstly it occur in cecum, right? The descending colon, the ascending colon and the transverse colons are also supplied by vagus nerve, right? For example, this is the cecum, and this is the ascending colon, this is the hepatic flexure, and this is the transverse colon, this is the splenic flexure, and this is the descending colon, this is the sigmoid colon, rectum and anal canal. These parts, the cecum, ascending colon, the hepatic flexure and the transverse colon, they are supplied by vagus nerve, the 10 cranial nerve, right? Now these are the organs which are supplied by parasympathetic nervous system, right? And now what this remaining parts are supplied by? Anyone? The remaining parts of the large intestine, gastrointestinal, they are supplied by the spinal nerves, which are arising from S2, S3, S4. They are also parasympathetic. S2, S3, but one thing other about this gastrointestinal system. For example, this is the 10 cranial nerve, which is called vagus nerve, right? I am taking some of the organs here. For example, this is the esophagus, this is the stomach, these are the small intestine, this is pancreas, this is the liver, right? What is about the ganglia of vagus nerve? The vagus nerve is very long. This is not one nerve, right? There are a lot of thousands and hundreds and thousands of vagus fibers are coming in this one nerve, vagus nerve, and the fibers are innervating all these organs. So for example, they have very long vagus fibers, and for example, this fiber is innervating the esophageal ganglia, right? And here they have a very short postsynaptic neuron, very short postsynaptic postganglionic neuron, but in vagus they have very long presynaptic neuron. Presynaptic neurons are very long, and postsynaptic neurons in this condition in vagus nerve, they are very short, but it is working on acetylcholine. So for example, this is the nerve coming from vagus, this is the presynaptic end, and this is the postsynaptic, and here it have the effector end, and this is for example the organ which is supplied by this vagus nerve. Here it is stimulated by acetylcholine. Acetylcholine means that this ganglia is cholinergic, but this postsynaptic neuron, they are making the neuromuscular junctions with the smooth muscle, and they are also cholinergic in nature. What is the purpose of this point? When we are taking the cholinergic drugs have a lot of side effects. Why? Because all these ganglia are working on acetylcholine. For example, you are blocking some receptor in this ganglia by cholinergic antagonist. These antagonists also go and blocks this ganglia. So due to this reason, the cholinergic antagonist and the cholinergic agonist have a lot of side effects, right? For example, here it have also a very short postsynaptic, but all are working on acetylcholines. This is hepatic ganglia, the gastric ganglia, the esophageal ganglia, the pancreatic ganglia, right? They are working on vagus activities, right? Now, what thing is remaining? This part. What happens to this part? what fibers or which fibers are responsible for innervating the parasympathetic activities in the last parts of gastrointestinal system, right? For example, I have again this is the वालेकुम सलाम सर क्लास से टाइम शुरू की टाइम से नहीं जमा दो क्लास में लेट बीच भी सर तब फ्राइडे पोरस में 11 पोरे हाँ हमारा सकी वो क्लास ही सर फार्माकोलॉजी डबल क्लास होती है
और फिर 11 बजे के बाद आपकी लाइब्रेरी या वो नहीं है
मैडम और रखा नहीं रखा डायरेक्ट डाला. This is the central nervous system. We have discussed the cranial nerves. These are the parasympathetic parts of brain stem or in brain, right? But one thing here, the neurons which are working inside the central nervous system, all the neurons which are working inside the brain or central nervous systems are cholinergic, right? All the neurons are the motor pathways of this system are cholinergic, right? These nerves, the 3rd, 7th, 9th and 10th nerves are cholinergic in nature, right? Here this is the spinal cord, and here for example this is the S2, this is the S3 and S4, the sacral region, S2, S3 and S4. These nerves are also parasympathetic in nature. Are they having parasympathetic fibers? And these parasympathetic fibers, they innervating the remaining parts of large intestine, like the splenic flexure, the descending colon, the sigmoid colon, the rectum and the anal canal. They are supplied by these sacral nerves and they are parasympathetic. Parasympathetic mean parasympathetic, and they are working by acetylcholine, right? This is the parasympathetic or the cholinergic neurons in the parasympathetic nervous system. These all, right? Now we are going into sympathetic divisions. Sympathetic division is starting from anyone. It is starting from T1, right, to T12, right? T12, the L1, L2, L3, L4. This area is called the thoracolumbar region. Thoracolumbar region, and thoracolumbar region is sympathetic. Thoracolumbar region, right? For example, these are the nerves which are arising from sympathetic fibers. But one important point here, that in cranial system, parasympathetic system, the preganglionic neuron is cholinergic, the postganglionic neuron is cholinergic, the effector end is cholinergic. Here also acetylcholine is working, here acetylcholine is working, here acetylcholine is working. But in sympathetic nervous system, these are the preganglionic neurons. These are preganglionic neurons, and from here it will innervating the organs, right? Here this is not, this is cholinergic at working on acetylcholine, the preganglionic neurons. But here, for example, these are the smooth muscles, right? All sympathetic fibers are not cholinergic in ending. They may be act on epinephrine, norepinephrine. For example, the heart, the beta adrenergic receptors. Beta adrenergic receptor present on heart, right? These fibers which innervating here, what is the role of sympathetic nervous system? The fight and flight mood action. Mean that in normal conditions, if we take the example of heart and parasympathetic, the heart is in bradycardic condition and parasympathetic activity. The heart rate is slow or normal, right? But if there is some emergency or fight and flight mood, the sympathetic activity is well working. And for example, these are the sympathetic nerve fibers, sympathetic nerve fibers. And here it is not releasing acetylcholine. It releasing epinephrine, epinephrines, and epinephrines are working on beta adrenergic receptor, not beta cholinergic receptor. These are beta adrenergic receptors, and due to the stimulation of beta adrenergic receptors, the heart rate will become high. It is called tachycardic conditions or tachycardia. So tachycardia is caused by sympathetic activities and bradycardia is caused by parasympathetic activities. This is the difference, right? The sympathetic endings are working on epinephrine, norepinephrine or other things, and in parasympathetic activities the endings are working on acetylcholine. But some of the fibers, some limited fibers, they are working on acetylcholine, like the sweat glands. For example, this is the nerve ending and this is the sweat. This is the sweat gland. The sweat gland connection, it is by acetylcholine. So some of the fibers also working on acetylcholine, mean they are cholinergic and sympathetic nervous system, but mainly the postsynaptic neurons are the effector ends of the sympathetic fibers. They are not cholinergic. Only the preganglionic fibers are cholinergic, right? So what is the summary? Here we have parasympathetic system and here we have sympathetic system. In parasympathetic system there are two parts, one is spinal and one is cranial. The cranial nerve 3, 7, 9th and 10th are parasympathetic. They are cholinergic, right? The presynaptic, the preganglionic, postganglionic and effector ends are working on acetylcholine, so they are cholinergic. Here the S2, S3 and S4, these fibers are also cholinergic and parasympathetic. Here this is the sympathetic, the thoracolumbar region from T1 to T12 and L1, L2, L3, L4, they are sympathetic fibers. And the preganglionic fibers of the sympathetic nerve systems are cholinergic, and these the postsynaptic or postganglionic fibers are non-acetylcholine fibers, but some of them are cholinergic. For example, the sweat glands, the endings with sweat gland. After this we will go for the cholinergic receptor. This is the normal physiology of cholinergic system, right? Now we will discuss cholinergic receptor, the drugs which are acting on which receptor, cholinergic agonist and antagonist. Any question up to here?